Welcome and thank you for joining us in the session Best Practice Emerging from Asia in COVID-19 Suppression and Containment. Best in Test and Trace, Shielding, info-demic Control, Patient Support. Moderated by Michael Alzona, Patient Engagement Director, Japan, China, Asia Pacific at MSD.
Hello, everyone. Thank you once again for joining us in this second Asia Pacific Patients Congress. Again, my name is Michael Alzona. I'm the Patient Engagement Lead for Asia Pacific at MSD. And I thank AYAPO for giving me this great opportunity to moderate this very important and highly relevant session. As we heard in previous sessions, now we learned about how this extraordinary global crisis we are experiencing now have significantly changed the way we look at our current systems. We saw how this greatly affected our healthcare systems, economies, education, livelihood, and more importantly, the lives of many people, actually everyone in the world. We recognize that no one was really 100% prepared. If you remember what Professor Sajeev said, no one was prepared for the COVID-19. But as the saying goes, in every dark cloud, there is a silver lining. Lessons learned and best practices actually emerged. And we saw in the past few months, our Asia-Pacific region is home to many of these great ongoing efforts to contain and control the pandemic. And today we are very fortunate to have with us in the panel three great speakers who will share with us their experiences on multi-sectoral collaboration in addressing the pandemic in their respective countries. Right now, I'll briefly introduce all our speakers and feel free to get more information about them at the AYAPO APPC website. So let me start with our first speaker. Our first speaker is Jessica Bean. Jessica is the President and Secretary of the Patient Voice Initiative in Australia, which is a collaboration between patients, including health consumers, researchers, and industry, working towards improving the patient voice in the Australian health system. She is an inspiration to many as she is a patient herself. Jessica's experience as one of the first cystic fibrosis patients with her gene mutation to benefit from genetic modulation therapy gave her that understanding of the emerging challenges faced by patients in the age of personalized medicine. This has actually inspired her mission to ensure patients and their values are represented in decision-making across the health ecosystem. So thanks to Jessica. Our next speaker is Dr. Vichai Chokvivat. He's the current chairperson of Heart to Heart Foundation in Thailand, a physician by profession, and a very strong advocate for patients. Dr. Vichai serves as Ethics Committee Chair for several bodies in Thailand, including Institute for the Development of Human Research Protections, the National Science and Technology Development Office, as well as the Thai Traditional and Alternative Medicine at MOPH. He served also as Secretary General of the Food and Drug Administration, Thailand, as well as Secretary General of the National Health Security Committee. With his extensive experience in the public sector, he will be able to share with us today how different sectors have responded through the leadership of the Thai government in this pandemic situation. And our last speaker, and definitely not the least, is Dr. Nikki Kitikiti. She is a public health specialist physician based at Duke NUS Medical School in Singapore at the Center for Regulatory Excellence, or CORE, and the SingHealth Duke NUS Global Health Institute Policy Core. Her work involves building multi-stakeholder alliances to support research, policy dialogue, and capacity building to contribute to equitable global systems for access to essential health services, vaccines, medicines, and digital technologies. Nikki is also instrumental in the creation of the Coalition to Accelerate Patient Engagement in Asia Pacific, or CAPE, at Duke NUS, which I'm very fortunate to be part of. So at this point, I will ask our speakers to share their presentations. And after all our presentations, we will have some time for questions and discussion. So without further ado, I'll give the floor to Jessica.
Thank you so much. Please just give me a moment while I get my presentation up. And I'll just confirm everybody can hear me okay. Wonderful.
Yes, very clear.
Great. So for those of you who are joining this session today who are not patients, I want you to take a moment to imagine. Imagine that all your life, or for a substantial part of your life, you've been told that protecting yourself from illnesses, particularly viruses, was a critical part of your health management. That doing this would prolong or perhaps even save your life. That your health was fragile, vulnerable, unstable. You were conditioned to these messages. And then COVID happened. The daily media was almost exclusively stories about the seriousness and uncertainties of this virus, not only on people, but also on the healthcare systems. The narrative was often one of fear, emphasizing that vulnerable people will die, and you were the vulnerable people. This was the situation many patients, including myself, found ourselves in at the start of COVID. And for this reason, many of us minimized our exposure to public places, including healthcare providers. However, COVID-19 has impacted the world for a lot longer than we initially anticipated, meaning that for both individuals and for our healthcare systems, the implications of patients delaying or avoiding their healthcare entirely for long periods of time has significant consequences beyond COVID. Back in March, navigating not only COVID, but COVID with a chronic health condition was very confusing. Healthcare providers, the people that we'd usually turn to for advice at this time, were particularly busy. They were not always available to speak with or to be sharing regular updates with patient communities. The feelings and concerns of patients like me are one example of the conditions that led to a huge drop in Australians attending the healthcare that they needed by April this year. The concern from leading healthcare organisations required a fast and collaborative response to protect the future of health, not only for the Australian population, but also the health of our healthcare system. By bringing a range of organisations together under the continuity of care collaboration, it was possible to share data and dialogue frequently and drive a response that was focused on consistent messaging with broad reach and organisations that knew their different communities and could communicate and tailor the messages appropriately. Over the time that it's existed, the CCC has built a membership of 30 organisations, large and importantly small, peak industry bodies, healthcare providers, and the London agency who have coordinated much of the communication strategy. This multi-stakeholder approach has been recognised as unique, including recently receiving an award, and has meant that the group was connected with all parts of the healthcare system, which I believe was really important to its success. The work of the CCC has included a survey to understand the issues, messaging through earned traditional media, newspapers, television, and social media, online events, and email mail-outs through big membership databases, including health insurer Medibank, and a website with central resources. One activation of the CCC, which had a particularly Australian flair, was one that we called Don't Wait, Mate, encouraging people not to delay their healthcare. This campaign received bipartisan political support and also really encouraged that peer-to-peer or patient-to-patient sharing, which we know is particularly powerful online. As a patient, what I think is particularly important about the CCC is that without working extensively with the health consumer organisations, the providers and industry groups, they could have definitely identified the need based on what they were seeing in the data. They could have put a campaign and messaging together. But what they would have missed was the comprehensive insights about what patients and the community needed to hear at that time, that was offered by the CCC, what concerns and uncertainties patients had, and then how we could address those in messaging, and that two-way dialogue. This approach focused on communicating with patients from a range of trusted sources, not communicating at them. We have been incredibly fortunate with the success of our response to COVID and in Australia, and we're now seeing that healthcare visits are returning to a more normalised level in most, but not all areas. As I'm sure that you can appreciate, this is a changing environment, so continuing to evaluate and assess need is also really important at this time. But I think there's one really key success story in what the CCC has done. And that's been the effectiveness of collaboration in the healthcare sector and the approach to patient and consumer involvement. Not only has it proved a case that we can do it in a fast-paced environment, but I hope all the other stakeholders can see that it is incredibly valuable to do so, and do so in a meaningful and cohesive, yet flexible way, acknowledging the diverse needs of patient communities with communication. I hope that this can be a takeaway from this incredibly challenging time, and I think it should remain front of mind when we are thinking about other public health messaging, and particularly things like vaccine rollout. What we can learn from the CCC to share in the messaging going forward and how we worked. Particularly when we are likely to see large volumes of information again and the need to amplify wide-ranging yet accurate information sources. It was such a pleasure to be on this panel today, and I really look forward to your questions at the end. Thank you, Michael.
Thanks, Jessica. This is definitely a very good example of a multi-sectoral collaboration, and patient involvement was really key to the success. And I have a number of questions for you later. So, but before that, I'll ask Dr. Vichai to share the experience in Thailand. Dr. Vichai.
Okay, thank you. Next slide, please. First of all, I would like to thank organizing committee for inviting me to join this session. I will talk in 4 topics. First, about the COVID-19 situation, then key of success, and then background for success, then conclusion. Next slide, please. Next slide, please. This is summarize the situation of COVID-19 in some country. You can see that in Thailand, we have total case less than 4,000 cases compared to some other countries like the US, India, Brazil, UK, and Italy. And we have only 60 cases dead, and case fatality rate is only 1.6%. Next, please. So we are quite successful in controlling this COVID-19. And this is I analyze the keys of success. First is the early recognition. When China report the outbreak to WHO on December 31st last year, and then on January 1st and 2nd, the meeting for preparedness of disease control expert in Ministry of Public Health Thailand. And then on January 3rd, we start disease surveillance in 4 major airports. And then on January 8th, first suspected case was found. And then on 12th of January, we can confirm the case by compare genetic sequencing with the genome that's shared by China on January 11. And then on January 13, we can announce the first case of COVID-19 outside China. Next, please. Next, please. Next slide, please. And then we do prompt response by contact tracing and tracking, and then containment of disease by state quarantine. And then we declare that COVID-19 is hazardous disease. That means that this disease will be under control under Communicable Disease Act. And then this disease is eligible for free treatment, testing, prevention, and control under our Constitution and under National Health Security Act. Next, please. Next slide, please. The third activity is active surveillance. That means prevention and control in high-risk area. The activity include testing, quarantine, improved sanitation, health education, etc. In prisons, in detention areas, in slum area, along the borders, and all passengers from abroad, and other high-risk area and persons. Next slide, please. Then we prepare for all the hospitals. We prepare for influx of patients. And then measure of prevention and control of disease. For example, medicine, medical supply, personal protection equipment, etc. Next, please. The next slide, please. And we have quite extensive cooperation of people nationwide. That is wash hand, wear mask, keep distancing, and food sharing. Next slide, please. Next slide, please. I analyze the background for success that we have long-term developments of our health system. First, we established epidemiological surveillance system since 1967. Public hospital are available at all levels since 1990. And we have residency training program for medical specialists since 1933. And we have field epidemiology training program for specialists on epidemiology since 1980. Next slide, please. Next slide, please. And we declare right to free health service for prevention and control of hazardous disease in our Constitution since 1974. That is after student uprising on 14 October 1923. And National Health Security Act, that we have universal health coverage with strong people's participation. People sitting in the executive board of this scheme. And lastly, we developed village health volunteer nationwide since 1938. Now more than 1 million village health volunteer in the country. Next slide, please. Next slide, please. So I would like to conclude that with a sentence spoken by Winston Churchill. He answered the reporter who asked him that after the Second World War, that why the small country like England can lead the Allies to win the war. And he said this famous sentence that well prepared wins the war. Thank you very much.
Thank you. Thank you very much, Dr. Vichai. Definitely being prepared really wins this war. But I think this is a very big war that not everyone was prepared as Thailand. So congratulations there. Now at this point, I'd like to ask Dr. Nikki to share her presentation.
Sorry, I was muted. Thank you, Michael. Thanks so much to Jessica and Dr. Vichai. I'll try and add on what I can from the Singapore perspective. So my name is Nikki, and as Michael mentioned, I'm working at the Duke NUS Medical School at CORE and So an outline of my presentation, I'll share on how our health system was prepared. As Dr. Vichai said, this is very important. The whole of society approach we have taken in Singapore, the patient-led community responses to COVID, not just in Singapore, but in Southeast Asia as a whole. And as a disclaimer, these views are my own and do not represent the views of any employer I have. Just so you understand where I'm coming from when I speak of COVID-19, this picture on the left, if you see me sitting on in the middle here on the chair, from the beginning of January, I was posted to a tertiary hospital in Singapore. And I was working in hospital planning when we got our first cases at my hospital. Eventually, I was redeployed to foreign worker dormitories. As you may have heard, in Singapore, we have a significant population of migrant workers from all around Asia who work mostly in the construction industry. These men actually live in purpose-built dormitories separate from the rest of Singaporean society, and these dormitories can house 1,000 men or more. So you can imagine how crowded some of these dorms can get, and you can understand why the dormitories became the focal point of our outbreak in Singapore. So I was working in the medical team and the foreign worker dorms from the first half of the year. Since July, I came back to my academic role at Duke NUS, where I've been preparing for a multi-stakeholder roundtable on patient engagement titled Accelerating Patient Engagement for More Resilient Health Systems. And I think I'll share a little bit more on that, but preparing for this roundtable, we conducted some research, interviews and survey among patient organizations in Southeast Asia. So we heard how COVID-19 had impacted them and how they had responded, and more broadly, how patients can play a greater role in the health systems in Asia. So these figures are available on Singapore's MOH website, but I just wanted to highlight some aspects. As I mentioned, we did have a difficult time controlling the outbreak in the dormitories, but overall, I think Singapore has done very well. For a population of 6 million, we only had 29 deaths, and we currently have only 60 active cases in the country. When you try and understand the Singapore outbreak, there's two points I'd want to make. The first is that we did have a lockdown, a brief lockdown between April and June. And when you think of the epidemic in Singapore, it's not really one outbreak, but really 3 outbreaks happening at the same time in the country. First, we have the imported cases, which are people flying back home from all around the world to Singapore. And initially, we didn't have a good hold on these imported cases, which then led to an outbreak in the community, which prompted the government to call the lockdown or circuit breaker in April. At the same time, this bottom graph shows that the cases in the dormitories started to skyrocket. And the main focus of our response in Singapore has really been in these dormitories. But as I mentioned, they are quite separate from the rest of Singapore society. It took us a while, but as you can see from the graph, since September, we haven't had that many cases. Most of our cases are imported and they're immediately quarantined and isolated. So of course, Singapore did very well in the fundamentals of epidemic response, which is to test widely, to trace the contacts of all positive cases, and to isolate those who are sick so they don't spread to those who are well. We've done very well in this and our system was well prepared. But I want to add a fourth foundation, which sometimes as public health specialists, we tend to neglect, which is really the support that we offer the people as part of a pandemic response, along with the epidemiological considerations before. So I'll talk a little bit on some of the support that the Singapore government provided to really achieve the success we've had in containing COVID, and I hope we continue to have. Our health system was well prepared. Our lessons from SARS in 2003 and H1N1 in 2019 have really strengthened our capacity to respond to new outbreaks. In fact, we had built a new center for infectious diseases that had just been officially opened just in September of last year. So when the cases came in January, we were ready, and this facility was able to help us to ramp up the care provided for COVID-19. We have robust and extensive contact tracing capabilities, both at the ministry itself And we have contact tracing teams at every public hospital. We also leverage technology such as mobile apps, as well as tokens for those who do not have smartphones. We had a strong surveillance and testing strategy supported by researchers who developed diagnostic kits and our regulatory agency, which worked hard to expedite approvals to allow massive testing in Singapore. We also were able to roll out telemedicine to help provide continuity of care for those patients affected by the lockdown and the disruption in the health system. And it wasn't just the health ministry working for this crisis. We really took a whole of government approach. A multi-ministry COVID task force was created, which gave clear guidance to various sectors. A separate task force was created between the Ministries of Health, Defense, and Manpower to coordinate the response in the foreign worker dormitories. We used the legislative and policy powers to really leverage the resources of the entire government to respond to this crisis. And I think the most important factor was the transparent and clear communications from our Prime Minister, as well as the task force head. The Prime Minister was always very honest, even when things were not going too well. And I think everyone appreciated knowing what is happening, to know that we still have work to do. And I think from our experiences from past epidemics and other crises, Singapore was really united. And of course, since it's 2020, we even have a hashtag, which is hashtag SGUnited. There was a strong response from the people sector, which is civil society and NGOs, public sector and private sector working closely together. And like I mentioned, you have to give the support to people for them to adhere to the guidances. So the government was able to provide clear information through a WhatsApp group that every Singaporean could subscribe to. The government distributed free reusable masks to every household in Singapore. And there are various support schemes for individuals that have to quarantine or isolate. And these support schemes are also available to businesses. We also had special support given to our migrant workers in Singapore. Like I mentioned, the medical teams, we were there. And I think there was just a broad solidarity from everyone in Singapore to show their appreciation to these men who really make Singapore work. And if you come to Singapore, you'll notice our skyscrapers, our clean streets, our very well-manicured garden city. And it's these men who make it possible. And everyone came together to support them. We also held a webinar in June at Duke NUS, which was highlighting how patients in Southeast Asia, so we heard from patient groups in Thailand, in Singapore, in Indonesia, and in Philippines, who shared how patient organizations had actually come to support the community gaps that existed after lockdowns were implemented around the region. Patient groups mobilized food, money, medicines to really meet that gap that was happening. And I wish really more countries had what Jessica described in Australia. We also held a roundtable that I mentioned before, where we hope to start the conversation of how we can get all stakeholders to start that dialogue early on. So not just during a crisis, but we're better prepared for crises if there's always a constant dialogue between patient groups, regulatory agencies, ministries of health, healthcare professionals, and even the pharmaceutical and medical device industry. We introduced this coalition that we're creating at Duke NUS, and I'm happy to share any information with anyone who wants to know more about that. We hope this coalition to accelerate patient engagement in Asia Pacific, which we call CAPE, will be able to support evidence-based and systematic patient involvement in health systems across Asia Pacific. All these different groups have to work together and have to talk together during peacetime to be better prepared to coordinate the responses in times of crisis. So my key takeaways would be, as Dr. Vichai has already said, preparedness wins the battle. Those countries that were well prepared have done well across the board, regardless of their development status, regardless of political systems. And although our health systems were well prepared in some countries, we cannot forget that the front line of any epidemic is actually the community, so not our hospitals. And you cannot neglect to communicate, coordinate, and collaborate with the patients and groups on the ground in preparing, in responding, and even in the recovery phase. And lastly, I think we learned this lesson the hard way in Singapore, that no one is safe until everyone is safe. So you cannot have a society that can leave anyone behind. We can't afford it. We have to have an inclusive society. And I hope there will be major changes in Singapore to how we deal with migrant workers in our health system and the housing that we provide them. Thank you. If you'd like to learn more about CAPE, please do feel free to contact me. And thank you for giving me this opportunity to share on Singapore.
Thank you very much, Dr. Nikki, for sharing the Singapore experience. Certainly, the Singapore healthcare system is really a model for many countries around the world. Let me start the discussion and ask a question to you, Nikki, because you highlighted about no patient should be left behind. And you have mentioned about these migrant workers and you were hoping for that change. Maybe you can share, what do you think should be that change? No, what do we need to change? Because as you said, Singapore healthcare system is really very advanced, right, compared to other countries. But still, there is an opportunity to improve, as you said. So, what's your proposal for change?
I think the change has already started. The government has realized this was a weak spot in Singapore. We have universal healthcare in Singapore for Singapore citizens and residents. But before this outbreak, we did not provide primary healthcare services to non-citizens of Singapore. So which means that migrant workers would have to have insurance purchased by their employers to get routine primary care. So while we as doctors, like I was working providing primary care for that special circumstance, if this could be the normal, that would be really amazing. So these men have access, to all the chronic care care they need. A lot of them have high blood pressure, diabetes, and I think more needs to be done to include them in the primary healthcare services. They do have access to hospital services when they get injured or when they require hospitalization, but we can do more to support a truly universal healthcare for primary care as well.
Thank you, Nikki. I think that's a very important message, that when we talk about universal healthcare, we talk about all the people within the country, right? We don't forget those who are not citizens of the country. So I think that's a very important point. Now, speaking of no patient left behind in this COVID-19 situation, and I think I'll ask this question to Jessica. The continuity of care collaboration, the CCC, again, is a good model for everyone. But maybe the question would be, since this is a multi-sectoral collaboration, the question is, Jessica, who do you think should take the lead in your experience? And maybe you can share with everyone, what do you think is the best approach? Who should start convening all these stakeholders? You've shown us all those logos of the organizations, but who started it, and is it the right approach in retrospectively now?
Yeah, interesting question, because I think that if we're talking about sustainability, that is something we certainly need to consider in the future. I think that the dialogue really needs to be centered around the patient organizations, but the challenge is that during COVID, the patient organizations were already being just overwhelmed by patients seeking information from them, in which case other people had to step up. I think that ideally it would have been great to see more involvement from government in the CCC, but certainly not driven or led by government. I think the nature of the CCC and the success of the CCC really pinned on that patient group involvement. But they can't necessarily do the heavy lifting in terms of getting it going. Obviously that there were resources required for some of the work that we did. So again, it just highlights that we need to all sort of have a role within that and work in a truly collaborative way.
Thank you, Jessica. I think that's a very important point, again, about sustainability, because I think a lot of our attendees now are from patient groups. And similarly, I'm sure a lot of them are saying, hopefully they have this continuity of care, collaboration also in their respective countries, and there's the desire to take the lead, and I guess that's a very important message. We need to involve all the stakeholders, especially the government, for sustainability. But I like your tagline, "Don't wait, mate." Who thought about that campaign? And it really resonates, I think, to all the Australians.
Yeah, so that came out in a group discussion. I can't actually tell you who exactly had thought of that, but I think what was really unique about that particular campaign was it was a combination of both quite polished pieces, so going out through the media, through the communications agency, but also getting patient groups to tailor it to make quite unique, organic content, and to get patients also sharing their own experiences, taking a selfie when they went to a healthcare provider, to share that message with other patients and their loved ones. And I think that different approaches, all with the cohesive message, made it a really strong one.
Yeah, I totally agree, Jessica. In fact, when I heard about "Don't Wait, Mate," right? So, and this is a challenge for many countries, no? And I think the patient community is the most effective stakeholder who can speak with fellow patients, right? And give them the confidence to go back in the healthcare system and ask for the healthcare that they need. So, thank you, Dr. Vichai. You have shared with us that Thailand has a long term development in the public health systems. Now, many years, no, it took many years for Thailand to really strengthen the system. In your point of view, now we are in this pandemic situation. How do you think is the role of patient, no, in making this more stronger? I mean, the public health system stronger.
Yeah, because in our health system, we include people participation at all level of governance, like in National Health Security scheme that cover about more than 70% of population. In the governing body, we have representative of the people, 5 persons sitting in the executive board. And not only in the executive board, we have a quality control board, and also we have representative from people, 5 group of people sitting in the control board. And as I mentioned, we include the role of village health volunteer, which is now we have about more than 1 million volunteer nationwide. They take very strong participation in this event.
Yeah, Dr. Vichai, maybe a last question for you is talk more about that village health volunteers. I think our participants will be more interested. How do you establish that volunteer group in your health systems, and how the patient community can be part of it?
Yeah, we start this scheme more than 4 decades ago, more than 40 years ago, when at Almata conference for primary health care, and we encourage people participation. And so we start from then on, and we work closely with our health system. We have about more than 10 volunteers in each village, working with the health officials in every village throughout the country, and work closely for quite very long time. So this is a very strong people participation. We not only have people participation, we try to empower them empower them, working with them, as Nikki said about SARS epidemic, about flu 2009. All the village health volunteers have role to control those epidemics.
Thank you, Dr. Vichai. Unfortunately, we don't have enough time, but I'm sure this topic is worth more hours of discussion, and I'm sure our participants would be interested to get in touch with all our speakers. I'd like to thank Dr. Vichai, Jessica, Dr. Nikki for joining us in this panel. So thank you very much for sharing your experiences.
Thank you very much, Mike, and your participants. I think what came through was compassion. I think Asia Pacific has really, really shone through today. And the other thing that came through was the lack of democratic deficit. Meaning the government, the state, and the health system is one with the people. So that was very important for Asia Pacific to recover quickly. Thank you very much for your time. And I'll now ask the production team to prepare the audience for the next session. We have a mobility break within which we can stretch ourselves. Thank you.